keratosis, actinomycosis, bronchopulmonary mycosis, meningoencephalitis. These words may be a mouthful to say, but did you know that there are medical codes that are used to represent these diagnoses? Welcome to Medical Coding 101 for ICD-10. My name is Quilisha Patterson and I will teach you the basics to ICD-10 medical coding. In this video, I will explain to you 1. The development of ICD-10, 2. Why medical coding is important, and 3. The basic formatting of ICD-10. So what is ICD-10? It was created by the World Health Organization, also known as WHO. It was designed to be a global classification system used for statistical and reimbursement purposes. Basically, whether you are in China, Australia, or Italy, this manual is widely used so that we all can speak the same language when it comes to diagnoses, symptoms, conditions, and injuries. ICD stands for International Classification of Diseases. The number 10 represents its current edition and the CM stands for Clinical Modification. From ICD-9 to ICD-10, there has been some changes. For example, some changes in ICD-10 include 1. More specific ambulatory and managed care encounter codes. 2. More injury codes added. 3. More combination diagnosis and symptom codes. 4. More characters added to the codes, which are now alphanumeric. 5. More specified diabetes codes. And finally, 6. Overall specificity to all the codes used, meaning, no generic codes are used to describe a specific or complex disease. When we use ICD-10 coding, it establishes medical necessity for a patient's care. Basically, ICD-10 codes explains why the doctor is doing a particular procedure or test. For example, an amniocentesis, which is the testing of the amniotic fluid during pregnancy. This test is used to evaluate the evidence of spinal bifida, which is a birth defect of the spinal cord. When we use the correct code for spinal bifida, which is Q05.9, it ensures accurate and timely payment for services, which is for the amniocentesis. Again, ICD-10 codes explains the why for the patient's visit or appointment. In this screenshot example, you can see how items 1, 2, and 3 has a specific ICD-10 code or codes tied to each procedural code. For example, look at line item 1, which is procedural code for describing an outpatient visit. Also, look at the bottom of this screenshot and see how many times this procedural code is used for each ICD-10 code. The answer is 3 times. Here, here, and here. Basically, this code explains the reasons for the patient's outpatient visit, which was for diabetes, hypertension, and hyperlipidemia. To recap, in this video, I explained 1. The development of ICD-10, 2. Why medical coding is important, and 3. The basic formatting of ICD-10. Thank you for watching my video.